Hello, everyone. Thank you so much for joining us for our fireside chat with Dr. Janet Phoenix, our 2025 CEHN Child Health Advocate Community Award recipient. We're very excited. I've known Dr. Phoenix for, at least over 2 decades now, and have been thoroughly impressed, inspired uh, every day by the work that you have continued to pursue, not only in the DC metro area with your incredible persistence and dedication to this metro area and the children and the vulnerable populations of this area, but obviously the implications throughout the country for the work, your life's work that you have done. So Ellie Repp, our program associate, is gonna give a little bit of an intro for those of you who don't know Dr. Phoenix, and then we're just gonna have a little chat here.
Yeah, so Dr. Phoenix is Assistant Research Professor at the Milken Institute of Public Health at George Washington University. And I have the great opportunity to connect with Dr. Phoenix working on the Washington, D.C. Environmental Justice Coalition as well. So we're very excited to have this chat with you today. And yeah, we'll move on to the first question.
Thank you, Ellie. So I think it's important for our listeners to just have a bit of a grounding. Many of us come into this work many different ways. So, Janet, what was kind of the impetus? What were some of the first motivations for you when you first started to understand that our interactions with the environment can have a positive and or negative implication on our health and well-being?
Well, that's an interesting question. I appreciate your asking it. I think for me, um, I came to this work and to the intersection of environmental health in a couple of different ways. When I was quite young, I got introduced to some readings that really highlighted attitudes and kind of the spirituality and caretaking approach that Indigenous communities have towards the environment and the earth, and how they view us as being charged with the responsibility for looking after the earth, including all the things that grow and live and flourish on the earth. And that includes human beings as well. I My father was in the health field. He was a pharmacist, and he used to take me to work with him and let me count pills in the basement of Howard University Hospital, which was at that time in the old building. It was called Freedman's Hospital. And the pharmacy was really just a stone's throw from the emergency room. So I saw a lot, just sitting in that pharmacy counting pills. I saw very, very ill people, kind of going back and forth, and the work that many were doing to care for those people. And that kind of prompted me to want to become a physician. So I became a physician, but not necessarily connecting kind of health with the environment, not really understanding the ways in which the things we do or don't do to care for the environment can have either a positive or a negative impact on health. And I didn't really understand those connections until, I'd left medical school. I had done a year of public health training at Johns Hopkins. And my very first year of doing kind of some practical field work was with the DC Department of Health. And I was assigned to their lead poisoning prevention program. I think they wanted me because I was a physician, and they needed people who could go out into the field, interact with the families of kids who had elevated blood lead levels, who were lead poisoned, um, and take regular samples from them, so that we could monitor and make sure that what we were doing to try to help the families address environmental lead triggers in their home environment was actually having a positive impact and bringing the kids' lead levels down over time. And so I began to see, that connection, between health and environment because of the patients who I was caring for, the families and their young kids. And lead, it was such an insidious thing because, the children really looked normal. Really, there was nothing really that could highlight for us the fact that they had been exposed and that they had this harmful chemical in their blood, other than the blood tests, and their behavior when they got to school, because of the connection with attention deficits and hyperactivity. So I ended up spending the first 20 years of my career, working on lead poisoning prevention at many different levels. I'm glad that I started at the level of really interacting with families and seeing the kids, the hands-on, because then when I was tasked with helping to develop the policies, I could bring that experience to bear, and so the policies could be more relevant to the lives of people who are actually experiencing this, instead of the way some policies are crafted, kind of at the 10,000-foot level by people who really don't have the benefit of understanding, what the real lives of the people who these policies are designed for, what the impact will be on those lives. So it was kind of those two experiences, the early appreciation for our responsibility to care for the earth and everything alive on it. And then my health training, and then gradually beginning, as a result of that early work experience, to see that, really entirely preventable things. There was no reason why the children I worked with had to be lead poisoned. It was because of, they happened to live in a home, usually a low-income rental home that had not been properly cared for by the owners. Chipping and peeling paint was allowed to go on. They were exposed to it in that way. That didn't need to happen. And so working on policies to help prevent that, and also working on getting the resources to cities like DC and to Baltimore, cities where we have a lot of low-income, older housing that was built before 1978, really kind of helped connect the dots for me, to see the nature of the problem, to see the root causes of the problem, and to be able to work on things that could really address the problem, whether it was changes in laws, and regulations, or making sure that resources flow to where they needed to go.
Thank you so much. I heard so much in that very rich answer. I heard your acknowledgement of just your surroundings, which I see more people doing, understanding that we do interact with our environment and being aware of that early on. I also heard you bringing that into your practice, which more and more healthcare practitioners are doing, and yet we still have a gap among our general practitioners, our pediatric, our nurse practitioners, some family docs, internal med folks, OBGYNs. So there still is, I think, a lot of work to do. Some of the early work that the Children's Environmental Health Network did, starting out in California in the late 80s, was starting to train healthcare professionals on how and why children are vulnerable to environmental hazards. And it's still one of the most frequently asked questions that we get, as far as how are healthcare practitioners, incorporating. So you've continued, I think, to be an incredible leader in the healthcare professional movement, in the academic movement, and certainly community health movement. So thank you for those reflections.
Yeah, thank you so much for sharing that. And kind of as a jumping off point, similarly, we know that you have a passion for protecting the most vulnerable and have been working for decades to do so. So why do you think that we still have to advocate so hard for something that should be a lot more natural at this point?
Well, children, have been at a linchpin of my work for many years. And, my work on childhood lead poisoning has evolved to working on within a healthy housing framework. It's grown to include childhood asthma. And actually, I spend most of my time now working on childhood asthma and trying to, prevent the housing conditions that contribute to high rates of asthma. And DC has the glory of having been termed one of the asthma capitals of the nation. And that's a glory you don't want to have. But I think that we've seen changes in demographics in the US, and 50% of children are low income, or lower middle income. And so not only are they unable to speak for themselves and advocate for themselves, but increasingly their caregivers are less able to advocate for themselves because of their economic conditions. And so, we really need to work hard to make sure that, the framework that we set up and, the programs and policies that we support benefit those who cannot necessarily advocate on their own behalf, so that they benefit children, so that they benefit the sick. and so that they benefit people who are low income. This is critical. This is how you judge a society, how well it cares for the least.
Yeah, thank you so much for emphasizing that. It's really true. We're only as healthy as, our least healthy in a society. So it's really important to uplift from the bottom up. So we really appreciate that.
Thank you, Janet. Yes, I also heard true implications to the economy, right? And you're exactly right. How it is a true reflection in the mirror for us as a society. And the younger folks are watching closely. My own children, people in our family, people in our community, and they are scratching their head and they're frustrated, justifiably, and they're trying to figure out what their future looks like. And with that said, you spend a lot of time with our students, with younger people, with the next generation. What advice do you give your students or those that you work with who are a bit younger than maybe some of us as they look at the state of our economy, the state of our political infrastructure, the state of our public health, I would say crisis, because our kids continue to show us that they, generally speaking, are not faring well, even despite increased science and awareness. So what do you say to the next generation?
Hmm. Well, I really try to emphasize that it's more important now than ever, that we have, a well-trained, dedicated workforce, to continue providing direct healthcare services, but also, those working in the public health arena who are really trying to address social determinants and deal with some of the root causes that are contributing to high rates of illness and certain kinds of illnesses in certain populations. That has become more challenging. I mean, when I teach at the university, students are coming to me and some are questioning their choice of field, and wondering if there will be employment opportunities for them when they finish their degree. And I teach in the master's in public health program at Milken at GW. And so it has been challenging, particularly in the last year, to continue to motivate students to stay in the field. But some are coming to us because of the challenges. In some ways, they're inspired by the need, and want to contribute. They want to be of service to others, and they still see this as a viable way of doing so.
Thank you. I remember actually as a graduate of GW a minute ago, also, you just have that angst, that worry, now I've done this training at this point at your master's. How am I actually going to be able to unfold and implement this? And Ellie, recent graduate as well, of public health, and to think what our students now have to additional burdens and the reality of, hey, I have to be able to make ends meet. I have to be able to, pay for life, food, and all the things. It's unfortunate. And I think your advice is right on. We saw during the COVID pandemic, a lot of folks leaving healthcare for a lot of reasons, mental health just being one of them. And now we're starting to see an influx again of folks kind of re-entering in a much depleted field, my daughter being one of them. So I think what all of us could be doing as public health practitioners is encouraging, listening, and trying to make connections wherever we can, because there are people hiring. And there are certainly, maybe it's not the path that our students saw. I know a lot of students saw themselves going into federal service or local government service, and a lot of those jobs are not there anymore, or there are freezes happening, right? So let's still work to encourage and connect and make sure that the energy and the passion of our students does not get lost, and certainly that we don't lose more people in the public health field, because we need more to come in. Thank you.
And
Yeah.
if I could just follow up, I think people need to be more flexible. Certainly, in public health, we have we're placing more emphasis recently on health in all policies. And I think that as students graduate, with a degree in public health, for example, they need to think about placing themselves in non-health settings, and really providing that expertise that they can bring to help others to see the health connections in all sectors of work. And that may open some doors that you may not have originally thought of knocking on if you're a student, a young person who's just exploring career options at this time. But I also want to applaud organizations like the Children's Environmental Health Network, because, it gives me hope, and I think it gives many hope that, that there are organizations like CEHN that are out there, really on the cutting edge, advocating for and providing services to the most vulnerable. And so, if you're really, really lucky, you'll land in a place like CEHN.
Thank you. Agree. Thank you,
Thank you
Jan.
so much for that. And thank you so much for, continuing to inspire the next generation of public health workers and, really encouraging that flexibility to look for work in places that you might not necessarily think to find it. And so with your career, you've had an amazing one. And we're wondering, in reflecting back, what you're most proud of.
Um, I think um, I'm really proud of my having had an opportunity to work at all different levels, um, and to really, kind of bring lived experience and the voices of people with lived experience to programmatic work, and to the policy work. So, I've been, working throughout my career to open doors and to kind of pave the way for people to advocate on their own behalf, usually parents of children, with elevated blood lead levels, or parents of children with asthma. And so I've been happy to kind of play a supporting role, and really trying to dedicate myself and support the role of those who are experiencing these harms, so that they can kind of tell us what they need and how they need it, and when they need it, so that the work that we as health professionals and policy professionals do, can really be more authentic, have fewer unintended consequences, and better serve the needs of those who we're trying to help.
Yeah, definitely. We really appreciate, that importance of connecting with communities to better care for them. So that's, yeah, definitely really important. Thank you for sharing.
Very well said. Health in all policies, making sure that the most vulnerable are actually at the center of decision making. Wouldn't it be a breath of fresh air for us to at least attempt? And of course, like you said, a lot of lived experiences happening around us that are really hard to ignore. Thank you for that. So, what gives you most hope as you look at the forecast and what's coming? We're on the tail end of 2025. Many questions and for 2026. What gives you hope these days?
Well, I faith has sustained me and continues to sustain me. Um, but the communities of people who I work with also help to sustain me. We've certainly faced a lot of unexpected challenges in the past few months, especially in terms of the funding that we had come to rely upon to do our work. And those challenges are not going away, and they may become more intense before they get better. But really, working with others who are like-minded and who, don't necessarily agree with every single thing in terms of approach or timing, but who, are working towards the same goals. That community of people, both my colleagues at the university, my colleagues in the advocacy campaigns I've worked on, that really gives me hope. And the young people who seem very bright, and who are not cowed by the current environment also give me hope, because we have not been able to solve as many of the problems as we had hoped to solve. We're not bright-eyed and bushy-tailed any longer. But there are people who will be stepping up to shoulder the work and to carry it on, and who may be able to come to better solutions, more creative solutions, to address the problems that we've been struggling with for a long time. So I think we need to take a breath. We weren't able to do it all. No generation is ever able to do it all. And trust that those who come behind us will be able to, to keep pace.
To keep pace. Excellent and very important inspiration, I think, for all of us. Take a breath, one day at a time, and understand that actually every day we are making a difference. It may not be splashy, it may not be the frontline news, but it's that marathon that we're in, right? It's not a sprint. So thank you,
Mhm.
Janet.
And kind of off of, a similar point, this year CEHN hosted a series of advocacy trainings for child health champions. And so we were wondering what your advice to these trainee champions is and what you think the most important thing that they can do to inspire change and equity surrounding children's environmental health in their communities is.
I think it's really important to talk to the people in your families and in your social networks about the work that you do. I very often don't do that, and I beat myself up for not doing it more. We had the oldest member of my mother's family passed away, and we had the celebration of her life last weekend. And so I was surrounded by relatives. My mother had 9 brothers and sisters, and they all, kind of took that phrase from the Bible literally, and they went forth and multiplied. So I have really so many cousins that, honestly, I don't know all of their names or the relationships. But I realized that, I rarely talk to them about my work. And that there's a gap sometimes, I think, in the work that we do, because we have this community of work colleagues and then we have our communities. And, we don't share the knowledge that we've gained or the insights that we have from, the work that we do with the people who are closest to us. So that would be my advice, is to try to bring your worlds together more, and let people gain the benefit of the work that we do, because so many people have no understanding, of the work that we do, or the impact that, that public health and environmental health have on their day-to-day lives. And if we spoke up a bit more, at least our family members would get it and spread it to others.
I love that. Power of
I
the
really love
connection, and
that.
why not start with those most closest to us? You're
Mhm.
making me think about my maternal grandmother who lived to 102, and I'm laughing because I tried on so many occasions to explain what it was that I do and what we're trying to change, and every time I heard her talk to a family member or neighbor, she changed it all up every time. So at some point, I just gave up. I don't know. I had 15 more degrees. I don't know. It was hilarious, but to your point, the people who love us and support us for sure should be and can be potential champions, and considering the divisiveness, I might say, that we find ourselves in out here, if we would just allow ourselves the power of just sitting down for a few moments. We may not agree on everything, but I have yet in 25 years to hear anyone say, yeah, I don't want children or the next generation of children to be healthy. I have yet to have anyone tell me that. We may
Yes,
not agree on how we get there, but at least we
yes.
can fundamentally come to that foundation, and then I think there's opportunity. But Janet, we so much gratitude for you, again, from the time just out of grad school, watching you, learning from you, still learning from you, how you show up in an authentic way, very humble way, but very fierce way. By the way, if anyone has seen Dr. Phoenix in action, she is no joke. And she's going to bring it in a very steadfast, steady, and respectful and loving way, I might add. So thank you for also bringing in your faith journey here, because I think that for those that have and find and follow a faith journey, I think that all is extremely important. So on behalf of the Children's Environmental Health Network, just thank you for this chat. We hope that any of you in the DC area listening, DC metro area, will join us October 9th for our 10th annual Children's Environmental Health Day Awards reception, but also 20th anniversary of just honoring those in the field, of which Dr. Phoenix is one. So we hope you'll come out and join us October 9th. Have a great day.
Thank you so much.